Hello, my name is Taylor Leathers, and today I'm going to demonstrate how to do a wound dressing change. I have already identified my patient by my two identifiers. I have the right patient. Um, I have already done hand hygiene, and I have clean gloves on. So the first thing that you're going to do is remove the old dressing. So to do that, you use your thumb and you take off the edges with your thumb to lift it up, and then you slowly peel it back, and then this you will dispose of. So I have my biohazard bag down here, and I would throw that in there, and then I gently take all of the packing out of the wound and dispose of that in the biohazard bag as well. And now it's all out. So now I would take off my gloves, and then I would dispose of these and put on a clean pair of gloves to clean the wound. Okay. And then to clean my wound, I'm going to need extra gauze and sterile water. If I can get this all right. Okay, so here's my sterile solution, and here's my extra gauze. The gauze is opened and it's been in the patient's room, so it's okay that it's been opened. So I'm going to grab a couple gauze, and you can, if you have a tray, you can pour it into the tray and dab it out of there, or you can get it wet by dipping it in here. So I'm going to get the solution wet, and then I'm going to wipe from the inside out. Then I'm going to take these and throw those away and get a new gauze. Then I'm going to do the same thing inside out and throw that away. Then I'm going to do the same thing, get these wet, and then inside out. And then one more time so I make sure that I got the whole wound clean inside out. Then I'm going to throw that away. Then now to pack the wound, I have to take these gloves off and then put on my sterile gloves. So my sterile gloves are right over here. I'm going to grab from the inside out. Then I'm going to grab with my dominant hand, put these on, and I'm going to use my two fingers and put this hand on. Okay, so now my hands are sterile, so I can shoo this off to the side. And I'm going to grab this and peel it open. This is what's going to be going on the outside of my wound, so the dry dressing. Then this is the gauze that I'm going to use. So I'm going to take the gauze and pack the wound. Make sure to get all of the wound, even if it's a deep tissue. So I've packed the wound, and you want nothing hanging out over the sides of the wound. Okay. And then I would take the top that's going to be dry and place that over the wound. Then I'm going to tape in a window formation. So you would tape one on this side, then you would tape one on this side, and this side. And then to take off my sterile gloves, you would remove them. And then I would dispose of those in the trash. And then I would make sure that my initials and the date and time were on here, just in case you have a nurse who hasn't changed it in a couple days and it's supposed to be changed twice a day or whatever, that you know that it was not changed and you can documentate that. Then I'm going to documentate what the wound looked like, if there was any odor, and then how much. And that's it.